Hello, I'm Eric Brook, and welcome to Erk Pod. Erk Pod and action. Hello, I'm Eric Brook, and here we are. Today we are going to be playing Ambulance Life, a Paramedic Simulator. On a previous episode, we did 112 Operator. Now, this is going to be interesting in a way because, of course, I would normally be using this on Simulated Erk, which is my gaming slash simulator, as the name suggests, channel on YouTube. But I've recorded a whole heap of episodes, but I haven't put them together yet for Simulated Erk. So you'll be actually seeing this one on Erk Pod before you see it on Simulated Erk. I don't have a set timeline for when I'm going to do it on Simulated Erk because there is some editing that I need to do. Disclaimer before I continue with this one, just in case. Ambulance Life, a Paramedic Simulator. It's a simulation, but having said that, if you find medical procedures, simulated blood or simulated medical procedures, etc., distressing or whatever, and this isn't the episode for you, I totally understand that, but fair warning before we go into it. I have been playing for around 12 hours at this point, so I've got a fair idea what I'm doing. I am not a medical professional, have never been a medical professional. I have had emergency services experience, but not in the medical field. But this is probably the best ambulance slash paramedic simulator that I've seen. It does have issues, but let's get into it. So here we go. We are just going to continue with where I've got to before with Simulated Erk. So let's continue. And we've actually got, it's actually very detailed for what it is, keeping in mind, of course, that this is for entertainment purposes. So what we might do I don't think we've unlocked, no, we haven't unlocked that yet. So this is more suburban area. We've got various, but not all conditions have been unlocked yet. So we're going to do a regular shift. I know regular shifts aren't 45 minutes, but that's the most we can do. So we're going to be role-playing as a paramedic. We do have a paramedic partner. There's my character there. Her name is Stella. Alright, so we're in our ambulance at the ambulance station. We'll probably receive a call shortly. Ambulance 152. Ambulance 152. Alright, so we look on a map. So we're just around the corner actually from the incident. So I've got it on our map now. Need to get the pedestrians out of the way. So we've got an indicator. We're about 200 metres away around the traffic. Get as close as we can. I think we're over here somewhere. Yep, here we are. Right, there's our person down. Out of the ambulance. Hey, buddy. Can you hear me? So this is where we get our initial info from. Right lower leg. Okay, can you tell me what happened? Okay, stay calm, you'll be fine. Alright, let's have a general look before we... There's lots of blood. Nothing's really spurting out like it's an arterial bleed. Alright, so we'll ask him a couple more questions before we load him in the ambulance. Because once we load him in the ambulance, we can't question him anymore about this. Do you have any other health issues?
I haven't had any chronic illnesses.
That's okay, cool. Do you take any medication?
Yeah, I take some medication.
Okay, cool. Alright, let's get him into the ambulance. So we'll go and get our stretcher. Our partner will come with us. So we can see what happened. What we'll do is, well, we'll talk to this person here. What happened? Do you know the person?
Yes, we've been friends for ages.
Can you tell me what happened? It doesn't want to tell me what happened. Alright. So we can see here that they've nothing there because we're trying to work out what happened. So he's trying to do a stunt and he's fallen badly. Now we can't do things like spinal immobilization and that sort of thing. So we'll go back to the stretcher. So we'll load him up. Now, this isn't the way that you should do it, but it's the way it's been animated. Right, we'll go back in the ambulance. Right, so now we're doing our assessment. Head, myelinosis, whatever that is. Strong bleeding. Torso. And we know that he's got some bleeding, strong bleeding there. Got a deformed limb there. So that could be a break. Alright, now to help us, we've got our tablet here. So it will suggest a traumatic injury. Although, let's see, traumatic injury. Now we don't know if he's got a broken limb. So it's either a case of they're going to classify it as traumatic injury or a hemorrhagic injury and venous bleeding. So it's a bit of a case of, whoops, not respiratory distress. That's definitely not what it is. So it will suggest different treatments according to what you think the diagnosis is. Blood pressure, cuff, inspect for bleeding, and apply bandages if needed. Alright, so what we're going to do, my name's Stella, I'm with the ambulance. We're going to check your blood pressure. We'll probably do that on the other side. Although he's got a bit of bleeding there too. We'll check your blood pressure and your pulse. This will give us a bit more of an understanding of what's going on. Normal heart rate, normal temperature. Alright. Can I put a blood pressure cuff on you now? Or should we should bandage his arm first. Not a stethoscope. It's not what I selected. Alright, so we're going to patch up that upper. Okay, so we have to play this mini game of let's patch up the patient. Because he's got cuts.
Wow, I feel a bit lightheaded.
Okay, so now that we've done that, we can put a blood pressure cuff on. Because he's got cuts on both sides.
Don't delay transport. Let's go.
Alright, now it's saying that we still need to bandage him up.
So cold.
So we just got to follow the dotted line.
Blood pressure is getting too high.
I don't know what to do about it. Oops. Didn't follow the line properly the first attempt. So we've got to get all the greens on the left-hand side. Okay, we've done that. Okay, so we can check our protocol before we go. Make sure we've done everything. Yep, we've done that. Let's go to the hospital. So our partner stays in the back. I drive. Map. Hospital. So it's the guy in the back saying that the temperature's wrong, or he's getting too hot, or he's getting too cold. So we just adjust the thermostat as our first initial point. Move pedestrian. So they do give us some space in between the cars. We're around the corner from the hospital. But this has got some really tight turns, so you have to really go wide. Watch out for the red light and pedestrians, but we can go through. Okay, here's the hospital. We'll use the footpath because that's the emergency exit and entrance. Hospital. So we're telling our mate that we're at the hospital. So here's our guy. So this is the cutscenes that we have. So we had a score, had an A result. Now what we can do here, okay, Yuri, encountered patient condition serious. Patient's vitals upon paramedic or during paramedic treatment were stable, and he was stable on admission. And the worst things that he had was his blood pressure and his temperature. but 93%. Alright, so that's our first job done. Usually get about 3 jobs done in the 45-minute shift. Ambulance 152. Now, I don't like how dispatch says to hurry up. So we're all the way out up here in the mountains. Lights and sirens on. Got a tight corner. So there's been some sort of animal bite of a bushwalker. Ciao, pedestrian. Anytime you like. Alright, another one of these tight corners. Alright, so we're coming up. So there's a range of callouts that you receive, and the more you play, the more callouts you receive. There are training sessions. Alright, so somewhere here our patient should be. Alright, so we'll ask the lady what's going on. Alright, what's happened? Do you know the person?
Yes, we've known each other for a long time.
Did you see what happened?
When I heard them scream, my friend was in the lead, and I briefly saw a snake slithering into the woods.
So that's a snake bite. Did anything happen to them after you called?
They appear to be losing strength.
Okay, cool. Alright, nothing around of interest. So we'll talk to the patient. We don't know his name yet, so he's John Doe. Hello, buddy.
Injured my right lower leg.
Right lower leg. Can you tell me what happened?
I was about to go for a hike when I felt a sharp sting on my ankle. When I looked down, it had disappeared.
Okay. What did the snake look like?
I didn't see the snake, but my body is starting to feel hot.
Okay. So we can't ask him those questions in the ambulance. That's why I'm asking now. Do you have any chronic or current health issues?
No, no chronic problems.
Cool. Do you take any medication?
No, didn't take any meds.
Okay. Alright, stay calm. We'll get you in the back of the ambulance. Alright, so let's get the stretcher. So we can't do any treatments outside of the ambulance, apart from maybe putting a tourniquet on if the situation requires, but there's not much you can do actually outside the ambulance. Alright, Joe, my name's Stella, I'm with the ambulance service. We're going to check you over and we're going to make you okay. Alright, so we're going to open our tablet. Environmental hazard. Set in there, snake venom. It's also suggesting that it's possibly extreme stress. But I'm going to treat it as the snake bite. So he's got 2 out of those. Let's see for extreme stress, but it's not that. So we should treat it as a snake bite. Alright, what's the treatment? An oximeter, monitor temperature, vascular access, administer heparin and an O2 mask, oxygen mask. That's alright. What we're going to do for you, Joe, I'm going to put some equipment on you just to check your blood pressure and also your pulse. Why he needs to take his shirt off to do that, I don't know. Okay, so we're monitoring his temperature and his heart rate, and we're going to put blood pressure on. Alright, to make things a bit easier for you to breathe, Joe, we're going to put an oxygen mask on you. Alright. Now we can administer... yeah, we do need to inject. Alright, Joe, what we're going to do, we're going to give you a small needle in your arm, and that will give you some drugs that'll make you feel a lot better. That'll reverse the snake bite symptoms. Okay, you're going to feel a small sting. You can tell I've watched a lot of paramedic things on TV, can't you? Okay, we'll inject you there. There's a lot of drugs we can give here for blood clotting and snake venom. Alright, so what we're going to do, we're just going to check our tablet again. We've done all that. Heart rate's getting high.
Let's go.
His heart rate's high. Okay.
We have to do something now. Understood. I'll handle it.
His heart rate's extremely high. Now, it doesn't say to rush him urgently, but I'm going to rush him urgently. So if something happens in the back, you will get... Whoops. It's a little bit hard to control with a controller at times. Watch out for the pedestrians. I haven't cleaned up the blood from the last scene we were at. We need to watch out for these pedestrians. We're not that far from the hospital. Oh, this is the back entrance. We're almost there. Move, 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 move. This is the entrance, the preferred entrance that I've actually been looking for. Hospital.
Patient's temperature's dropping.
Alright, let's see how we went. Missing person found injured. Okay, he was found critical and we stabilised him. His heart rate was too high, didn't have enough oxygen, or we were giving him oxygen. Blood pressure was too high, temperature too high. But we did get his blood pressure down. So if we have a look now, some of the things I don't know how to do yet. We've done all the treatment. We correctly diagnosed the situation. Ambulance 152. Ambulance 152. Just around the corner. Move, pedestrians. Anytime you like. Now, they give us a bit of room to get down here. That's not necessarily easy. Well, I'd say that it'd be the park. I think I've been to this park before. Hello, what happened? The patient may not be able to talk. Can you tell me what happened?
We were having some fun, you know. I don't know, they suddenly fainted.
Okay, cool. That's all we'll be able to get out of her. Do you know what happened, buddy?
I just arrived here and they were already laying on the floor.
Okay. Can we talk to the patient? Hello? Okay, you can't breathe. Can't breathe. You know what happened? Do you have any current health issues?
No chronic problems.
Are you on medications?
No, I didn't take any meds.
Alright, calm down. You'll be fine. We'll work on you now.
I'm starting to feel a little better.
Okay, inhaled object. We don't know what that object is. Alright. Alright. Let's get the stretcher. Now normally the bed would go down, but alright, I'm Stella. I'm with the ambulance. Large neck. Alright, patient protocol. Environmental hazard, most likely. Allergic reaction. Stethoscope, clear the airway. Admit epinephrine, an oximeter, and an O2 mask. Alright, so what we're going to do, alright, going to check your blood pressure. And also your pulse. Alright, we're going to check your airway using stethoscope. Alright, partially blocked. Alright, what we're going to do, we're going to give you an oxygen mask. That'll make breathing a little bit easier. Now, if I remember epinephrine, yeah, that's more like an EpiPen. Alright. Alright, we're going to give you this needle in your leg, and that'll hopefully make you feel a little bit better. Alright, swelling's been reduced a little bit. Let's check our protocols before we've done everything that we can. Alright, let's set.
Oxygen levels are dropping fast. Tell me what. All right, I'm on it.
So we're supplying more oxygen. Luckily for her, we're not that far from the hospital. And of course, sometimes the car drivers don't do what you want them to do. You know, they're not necessarily mind readers, I know. Hospital.
Temperature's dropping rapidly. Getting too low? All right, I'm on.
Let me see. We take over from here.
Okay, so... Alright, so the patient was critical when we arrived. Patient's vitals improved during paramedic transport, but was still critical and was stable on admission. Now, initially, the heart rate was too high, oxygen saturation too low, blood pressure too high, temperature too high. But the only thing that was exceeded in the end was the temperature. Alright. So we've probably got time for one more, possibly two more calls before the shift ends. Ambulance 152. Right, we'll get them. Oh, we're all the way over there. Right, it's going to be a long not leave that ambulance, Stella. Wrong button. This is a long response. And I do want to get to the correct side of the road. If you let me get over there. I can tell this is a European game designer because they've given me a little bit of room to get through, which is a common thing they do in some places. Don't walk out, pedestrians, thank you. Now, I've never been a paramedic, never wanted to be a paramedic, watched my fair amount of paramedic shows on TV. The earliest one that I ever watched that I can remember was called Emergency. And that was based on Los Angeles. Okay, we're going downtown. Alright, we're using the exit. Next exit coming up. Okay, we need to go down there. Alright, we're going to take a left, left, left. Right, might do a bit of curb hopping here. We'll take a left, left here. So when you start off, you do start off working here in downtown. We're going to take a right, right, right. We'll zoom in there. Which is quite ironic because we're actually just around the corner from the downtown ambulance station where we start. Now I know where we're going. I'm following the map. As I said, it's a long response. We'll turn here. Watch out for pedestrians. Oh, it was in an alley, so okay, that's looks to be just around the corner. Ah, okay. Oh, the pedestrian ran into me! Oh, we didn't get there in the end. Drug overdose, we didn't make it. Now I wanted to go back. So we did everything okay with the... So we didn't make it. Unfortunately, we didn't make it. The pedestrian just walked into us as we were turning. What I did want to do, possibly... We had a look at the allergic reaction. I did want to show you the training, and we'll do that on the panic attack, I think. Oh, actually, we won't. Actually, we will. And I'm going to show you how they do it in training.
The next assignment? Let's get back inside the ambulance and wait for dispatch to give us a call.
So this is Angela. I like her better than the current partner I've got.
Calling ambulance 152. A person was reported hyperventilating downtown Pelican. Sending location data now.
Ambulance 152.
Copy. Heading there now. You know what to do. Quickly head to the marked location.
Alright, so have a look at the map. There we are. Now here where this station is located, it's often easier to go here. Don't block off my... Ah, damn it. Oh, there's an accident in front of us. Actually, next one. Actually, sometimes it's just easier just to go straight here, and the map will redirect. Oh, don't hit the tree. These things aren't always easy to control. And then we'll go around here.
Let's find out which people are in the condition might want to meet.
So, okay, nobody else around. Hey mate, Stella with the ambulance service, you okay?
Something is wrong with me.
Can you tell me what happened?
I can't. It's all too much.
Alright.
The patient appears to be breathing rapidly and is having trouble responding. Perhaps it's a panic attack?
Okay, so we'll go to the ambulance and...
Move it to the stretcher so that we can treat them inside the ambulance.
Alright, where's our patient? Alright. Right, we're going to put you in the ambulance and we'll have a chat. We'll work out what's going on, alright? So you can train on some calls before you actually get them.
Remember your training. Check the patient's vitals with our diagnostic tools, the blood pressure cuffs, and blood oximeter.
Okay, so I'm going to just do a general head to toe.
Once you're done collecting all relevant information, select panic attack as our interim diagnosis in the patient's protocol.
Okay, nothing looks obvious
I'm
down
sure
there.
that this is a panic attack, but in other callouts, I'll rely on you to make your best analysis from the information at
Okay,
hand.
so that's neuropsychiatric and a panic attack. Alright, so our treatment for that is to calm the patient. We've done. Attach an oximeter for O2 saturation, for oxygen saturation, an oxygen mask, vascular access, and lorazepam. Alright, what we're going to do, I'm Stella with the ambulance, and we're going to check your blood pressure, check your vitals, and then we'll give you something for what's troubling you, alright? So this is your blood, this is to check your pulse. So we've now got his pulse and his heart rate. Right, what we're also going to do, I usually do both anyway, blood pressure cuff, so we can check his blood pressure.
Oxygen levels are pretty low. We should try to get the patient's breathing back to normal. Try soothing the patient by calmly talking to them.
Open handbook.
This is also part of the level of patient care that is expected of us. You can read more about it in your handbook.
Alright. Please try to remain calm. It's okay.
Nice try, but unfortunately, this doesn't seem to help much. Oxygen values are still dropping. If this continues, we will need to administer some medicine to calm down our patient.
So what I would do
To be
first,
able to administer this kind of medicine, we need to use the IV needle tool to gain vascular access first.
oh, it wants me to do it this way. Okay.
Temperature is going down. This will be your first medical procedure. Try to find the correct vein and carefully insert the needle.
Okay, because it's a tutorial,
Always, you can read up on the ins and outs of the different medical procedures in your handbook.
because it's a tutorial, you have to go the exact way that it's telling you to go. Alright. So we administer lorazepam. Because it's a tutorial, we don't have access to any other drugs apart from the ones we need. Okay, this will make you feel better soon.
Okay, with the breathing rate back to normal, O2 levels are rising again. The situation seems to be under control. We should still take the patient to a hospital for further examination.
Okay, so what I would like to do here,
Drive. I will stay back here and keep an eye on the patient.
what I would still like to do here is put an oxygen mask on him anyway. But because it's a tutorial, alright, so we're going to drive to the hospital. we'll get the hospital. On the way back, I'm going to use lights and sirens a little bit because it's not super urgent, but I still want to get through this traffic. So we're going to the main hospital. Now this is a handy shortcut that I found. If you go through here extremely slowly, alright, there's our emergency department. Watch for pedestrians. Hospital. Different emergency department, same cutscene coming up.
Let's drop off the patient. Let me see. We take over from here. During our shift, the receiving hospital will evaluate your performance at the end of each call-up. This should help you better understand what you did right or what parts of your treatment still need improvement. Let's see how you did.
Alright, let's see, how did we do? So, encountered patient condition serious but delayed. So that's a process called triage. If you've got multiple patients, you select which ones you're going to see first. So this one's fairly serious but doesn't need super urgent hospital care. If you've only got one ambulance, for instance, you would pick the most medically one, the most person in the most medical need is what I meant. So if you got someone serious but immediate, you would take them over someone serious, delayed, or walking wounded. So they were stable during treatment, stable during admission. The worst recorded vitals in all, the heart rate was too high, oxygen saturation too low, temperature too high. But the only issues that we had in the end was oxygen saturation. And that was partly because we didn't put the oxygen mask on him. But we still got an A. Anywho, I have been right here with you. Thank you very much for watching. I have been Eric Brook. And another episode of Erk Pod is in the can. Eventually you may get to see this on Simulated Erk. I'll leave links in the show notes. And hang on, there's the camera. Cut. Thanks for watching. Ta-ta and farewell. Don't forget our shirt of the episode from Newcastle Sticker Collective is this one. For 10% off any t-shirt or other merchandise that I've designed, use the discount code ERKPOD10 for 10% off your purchase. ntlstickercollective.com.au/democracy manifest ERKPOD10 for 10% off your purchase at checkout. ntlstickercollective.com.au/democracy manifest. Thank you very much for watching. Ta-ta and farewell.